Thank you. Thank you. Thank you. Again, I'm your host, Eddie Jean Hall Jr., and joining me today, as always, is my good friend and the co-host of The Urban Therapist, Mr. Lewis Rose. How you doing today, Lou?
It's a fantastic day to be recording a podcast.
Yeah, man, it's a good day. It's a great day. You know what? One of the things you said we were going to start doing, but I don't know, we're not going to do it on this show. We were saying we were going to take a minute to ask, like, what show, or series are you into right now? And we won't do it today, but man, next time I catch you, I got one for you. I got to tell you about. I want you to check out. It's good. Oh man, I'm telling you, it's good.
Sounds good.
But listen, we want to thank everybody for joining us today. Remember, you can catch us on Spotify, Instagram, YouTube, every tube. You can find The Urban Therapist, Apple Podcasts. We want to make sure that you go on, that you like us, that you subscribe, because you are now with us in our second year. And we want to thank everyone for following us. And this year, we're doing something a little different. And we hope you like it. One of the things that we are doing, we are having guest hosts on this year. And we've got a great guest for you today. And we've got a great topic for today. So, Lewis, you know me. I love comedy, and I have a lot of respect for comedians. And I love the way comedians can take the social issues that we're dealing with today and present them in such a way to enlighten us and to make us smile at the same time. And with that being said, I want to start a group. We're starting. I'm not going to say I want to start. Why are you laughing? I'm started a group.
Because I'm thinking about the other clip that you sent me. And I'm like, is he about to set up that clip? Like,
no. Folks, look, I had a clip I wanted to play for y'all today, but my producer and I had to agree wholeheartedly. We would have had to do the warning slide before we did the show that material contained in this in this show is not, but anyway, so I found something a little more tame.
Right.
Because today what we're going to be talking about mental health and medication. And we're going to be talking about the effectiveness of medication on different mental health issues. Now, we're not going to be able to exhaust the topic today because it's so broad. But today we're going to deal with two specific areas. We're going to deal with medication and depression, and we're going to deal with medication and ADHD, especially with children. So I want to start with, this series we're going to call mental health minefields. Mental health minefields. And so we're starting this series and talking about depression and psych medications and ADHD in children and psych medications. And we got a great guest to work with us today. But before we get started, I got a video clip I want you to check out that, and I want to make it clear because my producer told me, this is a parody.
Thank you.
About medications for depression. Check this out.
Sadness, exhaustion, a loss of interest in things you once enjoyed, excessive eating, just don't want to get out of bed in the morning. In certain situations, these can all be symptoms of depression. But I've said them in a way that applies to everyone, because everyone's who I want to buy Hordeolus, a prescription medication that will maybe do something to a few of you. Depression is a serious medical condition that can be diagnosed by only your doctor. You and she will discuss your options And if medication seems like the right choice, you'll try a variety of these flavorless candies. Over a long period of time, together, you'll find the specific dose of the specific chemical that helps you. And we'll put those chemicals in a candy that doesn't taste like anything, so you might as well swallow it whole. But even with the latest medical technology and the best circumstances, we don't know what chemical pellet is right. We're basically throwing what we think are darts in a pitch black room at a target that only maybe exists. But I'm hoping that if I show you a bottle of these brain chemicals near pleasant things, you'll learn to associate my chemicals with pleasant feelings, which will eventually result in a placebo effect that makes you believe that you need my product. I mean, helpful pellets of chemicals to feel joy. Hordeolus, flowers, cute little doggies, sunshine over flowers, hordeolus, smiling yourself to sleep, just flowers again, hordeolus.
Okay, so for the record, first let me let everybody know there is no drug called hordeolus, so do not go looking for it. But we want to bring out, listen, we're going to get right into the show, okay? Joining us today is my newfound friend, our newfound friend here on the Urban Therapist, and a woman I've grown to really respect and appreciate. Doc, thank you for joining us today. Let me, Dr. Ennis Wainwright, let me pull up again your resume, which I had here, which disappeared, Doc. Okay, see, this is what happens when, you're used to using paper and printing stuff, and your producer tells you, no, man, you got to use your iPad. And so, Doc, tell us a little bit about yourself, because I can't pull up your resume right now.
Sure. So I am Dr. Melissa Waybrant Ennis. Worked a lot with kids. So typically I go by Dr. Melissa. A little bit different now with where I work now. We don't call me Melissa there. But I have gotten my master's and my doctorate from University of Illinois of Chicago. I've specified in psych mental health. I have been a psych nurse getting ready to go on 10 years now.
Wow.
And I've been a provider for the last 6.5. Done a bit of various inpatient, outpatient, and now I'm in the prison. Working.
Okay, and let me correct that. Correct that.
Under anything other than working.
Oh, okay. Yeah, listen. I mean, even if you were in prison, we still would have you on the show if you were willing to be on the show. But we want to make it clear to folks: you're practicing by helping the people behind bars. You are not behind bars yourself. Okay.
Correct.
We want to make that clear. So, Dr. Melissa, thank you so much for joining us today. And listen, we were talking with that, and I tell you, it was so cool. We were talking, and I just asked Doc the question. I said, hey, Doc, listen, I know you prescribe medications. You've been doing this for a while. And I asked her, what do you think as far as prescribing medications were concerned? And then we had this great conversation all the way back to the dorm. And so I asked her if she would be willing to be on the show, and she said yes. And so we're going to talk about today. So we have a professional we're talking about today. We're talking about depression, and we're also talking about the treatment of depression. And we're going to talk about the pros and the cons of medication. So on the Urban Therapist, what we want, we're not saying that you should not take medication for your depression. But what we are saying is that we want to make sure that you are alert and aware of the different type of medications, their potential side effects, and, just to be versed on whether or not you should take it, the types that you should consider, and what's out there. And that's why we've invited Dr. Melissa to be with us to give us that information. Did I set you up okay, Doc?
Absolutely. I'm a big proponent. If you're putting something in your body, you should know what it is and what it's doing.
Great.
Absolutely.
So I tell you what, we got a few slides we're going to go to, and Doc, I just want you to run with them as we go to them. Now, first, I've got the definition of depression. One definition of depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. And let me add to that, it affects your activities of daily living. It affects how you function. So now, with that being said, there's something called antidepressants. So if I get depressed, there's something that's the anti, as we saw in the parody, that takes away or helps me with the depression. I shouldn't say take away, I'm going too far. So, Doc, let's start with this. Can you explain to us how anti-depression or antidepressants, how they work?
Okay, so this gets a little complex even right out of the gate, right?
Okay.
And it gets complex right out of the gate because number one, they don't all work the same. There's
Okay.
many different types. They
Okay.
all work a little bit differently. Um, but the premise is that we think these chemicals in our brain, neurotransmitters, these chemicals, serotonin, norepinephrine, and dopamine. What we hypothesize, and it some of this is hypothesis here, right?
Okay.
Um, and it's hypothesis because it's all going on in our brain, and it's not like we can dissect people's brains to figure out what's going on when they're doing it. I always tell people there is no blood test for me to take to find out what's wrong. It just, psych is not there. Maybe we'll be there in the future. We're not there yet. So these three chemicals, we think they're imbalanced. We're not sure how imbalanced they are. We're not sure if it's the same imbalance for every person. And quite frankly, it's not. That's why different types of medications can work for different people.
Okay, so
Um,
Lou, go to the next slide that has the 5 types of antidepressants on there. This is a category. This is not a list of um, brands, but this is the 5 type antidepressants when I was looking up, grouped together. So Doc, can you roll on this for us? Would this kind of help? I think this might
yeah,
kind of help our listeners right here.
exactly. So like the first category, these selective serotonin reuptake inhibitors or
Mhm.
SSRIs, they work by blocking or inhibiting reuptake of serotonin. Okay.
Okay.
And I use this analogy again. I've spent a lot of time working with kids, so I want to make sure that they understand what I'm talking about. And I use this analogy of we have receptors in our brains, and maybe think about them like baskets. And we have
Okay.
serotonin that bounces around in our brain, kind of like a basketball. And what's happening is either we don't have enough basketballs to go in the baskets, or we have not enough baskets to receive serotonin. Okay.
Hmm.
So what we're doing is either we're right out of the gate sometimes with SSRIs, we're getting a little bit more serotonin. So maybe there's a little bit more basketballs, or we're kind of toning down. And I misspoke. I said not enough basketball, like basket hoops. We have too many. So they're sucking too much out.
Ah, okay. Okay.
Okay. So we're kind of putting lids down on some of them when we take these meds. Okay. So that way you have fewer receptors available to take the serotonin and take it and put it
Okay.
through the rest of our body.
Okay.
Um,
And again, what exactly does the serotonin do in our brains?
Good question. We think it regulates our emotions. We think it
Okay.
impacts our depression. We think it impacts anxiety as well.
Okay.
Okay.
So we think serotonin impacts anxiety, and so it regulates our emotions. So we don't have all those basketballs going in the hoops. We're not scoring right up here, and that's why I might start feeling depressed. Okay.
Right. Right. And that's, again, like nobody chooses to feel depressed. No, nobody does. You don't want to feel down. You don't want to feel sad. You don't want to have not have that motivation to get up and do things. Nobody chooses to feel that way. It's a chemical imbalance, right?
Okay.
Um, the other thing with SSRIs, and quite frankly, all of these antidepressants, none of them work right away. Okay. They take a while. And it's because it takes a while to kind of close these lids down or make these receptors less hardy, less effective, less good at their job. So we have more serotonin available in our
So
brains.
you mean if I decide that I want to go, if I'm diagnosed with depression and I decide I want to go on medication, it's not going to work like that. Medication is not like that.
I wish, but it does not. Yeah,
Eh,
we estimate for antidepressants to reach full benefit, it can take as much as 8 weeks.
8 weeks.
Hmm.
8 weeks. 8 weeks. Okay, so anybody out there listening, if you've started and taking antidepressants, but you're still feeling a certain way, you need to give yourself some time, is what you're telling us, right?
Correct. Correct.
Okay.
Because that's the other thing, too, is, we don't put you on meds and then jack up the dose either,
Okay.
right? We put you on meds and then we wait and see what happens because we don't want you, and I'm saying we broadly as providers, we don't want you to
Hmm.
be on any more meds than what you need to be on. We want you
Okay.
on the lowest dose that's going to give you the best results. Okay.
Okay.
If we start raising dosages too fast, then you really run risk for side effects.
Okay. So for right now, if I'm prescribed something, I need to give myself at least 8 weeks for it to regulate in my body, in my brain. Okay. And that was for the SSRI. Now, is that for all those that are listed there? Is it the same thing? Takes about 8 weeks. So, what's the difference between the SSRI and the SNRIs and the TCAs and the MOI? I feel like I'm back in
Yeah, I know.
school going A, B, C, D, E, F, G. There are. So what's up with the rest of those?
So SNRIs are a little bit different. They are working on chemicals serotonin and norepinephrine. So now we've gone from just serotonin, we're adding norepinephrine in to see if we can get some relief.
Okay, so now
Okay.
what? Okay, so now we got serotonin. So now what's the nephorin? I know I killed that.
Nor, norepinephrine. It's just
Hmm.
it's just another one of those chemicals, one of those brain chemicals that we think aids in depression. We think when those levels are off, we're depressed, we're anxious.
Okay, so we got two different chemicals then working in our brains, and we've got two different type of antidepressants trying to get those chemicals that are flowing properly.
Correct.
Okay, so almost like rivers running through, making sure one doesn't go over the bank and the other one doesn't dry up too much. All
Yep.
right, what about TCAs?
So I'm going to preface this here. TCAs and MAOIs are old meds.
Okay.
Okay. They've been around for a while. We like to not use them as much. They are used, but not as like first line treatment.
Well,
Okay.
why? I have to ask.
Because TCAs and MAOIs can hurt people. If you take too many, they can be dangerous. SSRIs, SNRIs are just safer.
Okay.
Okay.
So, dare I ask,
Yeah.
what do we
So,
mean by safer? Or it
well,
can hurt you.
correct, right? So, part of depression is we talk about suicidal thoughts. Okay. So,
Okay.
that's always something that's evaluated as the provider. I have heard that they used to, like with MAOIs, with TCAs, they would only give like a certain number of pills to patients back in the day. And that was to make sure that they stayed safe.
Okay.
We don't really run that risk with SSRIs, SNRIs. Yes, you take too many of anything, it's going to make you sick, but
Okay.
not necessarily the same way.
So this shows the progress and the progression that has been made in the field of treating depression and other mental health issues through medication. There are safer medications. Now, they're not 100% side effect free, but they're
Correct.
safer than the previous generations. Okay.
Correct.
Now, okay. So now the next slide, and we're going to refer to that article if there's anything out of there that you want to share. Uh, that next slide, there was an article from Molecular Psychiatry. Antidepressants for the treatment of adults with major depressive disorders in the maintenance phase, a systematic review and network meta-analysis. And we threw this in because, Doc, I think you had a couple of points that you wanted to bring out of that article as far as what we're talking about today.
Yep. Yeah. And so just there's some big words even like in what the name of this article is, but like what
Okay.
this article is doing is it is looking at articles that have already been published. It's looking at a
Mhm.
ton of articles that have already been published, right? And then they are compiling their information from that to like really give us a better point of view of what happens for adults who struggle with depression but are kind of in that maintenance phase, which means that they're doing okay. We're still taking our meds, but we're doing okay. And it's looking at like, are these effective? Do they work? Are we seeing
And what is
results?
it? And I read through some of the excerpts that you sent me. There are some positive results
There are.
from
Um,
taking the
there,
medication.
yeah, there definitely are. And so this is more maintenance phase. I know there's another one I had sent to you that's referred to as the STAR-D trials, and that was like the biggest clinical trial we ever had with
Mm.
antidepressants. And what we find is that maybe antidepressants don't work quite as well as we think they should be working, right? Like when we really pull the research, it's wait a second, is this doing as much as we think it is? I will say they found out like when we get them to this patients to this kind of like stable phase that they actually did pretty good on certain medications. And now this is back to like those SSRIs, SNRIs. They did pretty good with those kind of meds.
Okay.
They do notice Zoloft, sertraline. Sometimes people have a hard time tolerating it. I found that in my practice as well. That's not a medicine I typically start with because I feel like people have a hard time tolerating it, continuing on it because of side effects. So, and the other thing that I think the studies always find, which to me is always important, is they always talk about the importance of psychotherapy, right? They always say psychotherapy has long-term benefits. And I mean, if you really think about it, of course it does, right? You do
Mhm.
psychotherapy to learn better coping skills, to learn better ways to do things, to better manage our feelings and emotions. If we don't really know exactly what's causing or setting off that imbalance chemically, you know, is it stress related? Gosh, there's stuff coming back about gut and microbiomes, and it feels like every month there's something new that they're like, oh
Something
wait,
new.
maybe this is kind of like where we're kind of leading down with depression. Um, but therapy always works. Therapy works. Let me rephrase that. Therapy works when you have the right therapist and you go and are open and willing and looking to change. Therapy
Now,
works.
I appreciate that, and Doc Melissa, that's one of the reasons I wanted you on the show as well, because as a mental health professional, one of the things that I've told my clients is that for some it is the combination of medication and therapy. And if you do the two together, you can get the best results. So, and
Correct.
that's one of the things I did read in the study as well. And it talked about the long-term effects of psychotherapy in dealing with depression. So, as we continue this, I got the second part of that video clip from the parody from
Ready?
earlier.
I'm
And
ready. The
Lewis
first one
came.
made me giggle.
I was like, what did you say?
I said the first part made me giggle because
Oh, you
yeah,
haven't seen anything yet. Wait till we get to talking about ADHD. But let's wrap up. We're going to finish wrapping up on dealing with depression and medication. Lewis, you ready for
Part
that
two.
that next one? Yeah, part two. Because after we watch part two of this, Doc, I want us to talk about the effectiveness, the risk, and the considerations. Some considerations for taking antidepressants. Okay, but here we go on part two. And the video is called "If Antidepressant Commercials Were Honest."
Now, no one knows exactly how depression works, so I drew up some fun little neuron cuties which will allow me to speak way too simply about it. Toby, roll the cuties! Here's a reductive representation of the inside of a brain. And here's depression setting in. This guy's sadness cloud is dark and scribbled, so it looks bad. Bad like how you feel. But because no one really knows how depression works, nobody really knows how antidepressants work either. Although, if we were to venture a visually interesting guess, we'd say that our pellets of chemicals push the sadness cloud away, making room for happiness balls. We made those yellow. Human beings react to bad weather by instinctively conserving energy and avoiding social situations. But I'm going to imply that this is a symptom of a medical condition, even though it's not necessarily. And compare that to this. Seems a lot better, doesn't it? Maybe if you take hordeolus, the weather will change. But you know, it won't. Again, only a doctor can diagnose you with depression. And if my drug, that I patented, is what you need, they'll probably help you find it eventually. But if the only people who bought my patented brain chemical pellets were ones who needed it, I wouldn't be as rich. Luckily, we live in a society where expressing emotions is seen as a weakness. So some people think that occasionally being on the unpleasant side of their emotional spectrum means there's something wrong with them, even though there isn't. If that sounds like you, please badger your doctor into ordering you to buy a monthly dose of the brain chemical pellets, which I have patented. If you're worried about side effects, don't worry. They can just include an inability to have sex or eat or sleep. These chemicals can even give you depression, which is figuratively the definition of irony. And we have no way to anticipate what the side effects will be because, again, we have no idea how these things work. I want you to buy my patented drug and go through all these terrible things I just mentioned, even though you might not even need to.
Talk to your doctor before trying any new medication, and please don't mention this ad because marketing prescription drugs for emotional disorders directly to patients like this shouldn't be legal, and we don't want to call any undue attention to what is clearly a failure of pharmaceutical regulations.
I mean, I think we touched on some of those things already, right?
Yeah, I think we did. I mean, I loved it. I mean, this, and so, but again,
cheek, right?
Huh?
I said tongue in cheek is always poignant.
They did a great job, and the young lady at the end who did the side effect voice. I mean, that voice was perfect. I mean, it's what you hear when you watch the commercials on TV. You know, it's like the one that just lets you know that this is what you're going to do in case if you don't. I was like, wow. But Doc, we want to make it clear again. we are not anti-medication. What we are about is being astute, alert, and understanding what's going on. And so let's go to the effectiveness. What's some of the effectiveness, and we'll wrap up with talking about some of the risk and what to consider if you're thinking about if you've been diagnosed with depression. Let me say it right. If you've been diagnosed with depression, what should a person look for as far as effectiveness is concerned? What should they know as far as risk are concerned? And what should they consider as they prepare to go on this journey? Or even if
Sure.
they are on this journey and they're saying, well, I don't think my meds are really effective. What should they think about? What should they consider?
Sure. Okay. So first off, not a magic pill. I wish I had magic pills that would make people feel happy. They don't exist. Okay. So I'm not expecting anybody to take this medicine and be like, I feel great. Because that's just not what this medicine's about.
Okay.
If you've got anxiety along with your depression, I absolutely expect to see a decrease in anxiety. They tend to these meds work really well for anxiety. Okay. So maybe decreased panic attacks, decreased racing thoughts, decreased anxiety. Absolutely. We expect to see a little bit more energy, a little bit more motivation. Okay. Feeling a little bit more like you're ready to get up and do things. When I describe this to kids and their parents, what I tell parents is, hey, I know we're giving this to Sally, but Sally may not feel any different whenever you come back and see me. But mom, what you may see is she's not in her room as much. She comes out and sits on the couch and watches TV with us. She talks with me about my day a little bit more. That's all positives. That's what we're looking for. Okay. That to me means I'm on meds that are I'm seeing improvement from. Does that make sense?
That makes a lot of sense. So if you're a parent and your child or your teenager is on medication, or even your loved one, if it's an adult, if it's your significant other, watch for results that they may not talk about. Notice
Correct.
if there's a difference in behavior that's more positive. Okay. So what are some of the risk and consideration? What are some of the risks? I'm not going to lie to you. Okay, I'm not going to say.
No, go ahead, say it.
That when he when he said one, I was like, for me, that made me sit up and say, hold on,
Yeah.
that's enough to make me depressed.
Well, there is always they do run that risk. Some of the antidepressants have less of a risk for like sexual side effects. There's also other.
How'd you know I was talking about that one? Okay, go ahead.
Because I'm an adult. Again, that's not something I worry about that much with kids. Talking about adults is a completely different thing. But here's the thing: is if you're being sexually active, how depressed are we?
I'm sorry. Was it?
And if we're being that sexually active, how depressed are we?
Oh, exactly.
mean-
I think one would be feeling rather well.
You would think.
Not
You would
if
think.
that medicine kicks in and it takes.
Not if that money's getting
Yeah, well, I think what Doc is saying, that might be one of those coping skills. Now, we're talking about doing that within the framework of a healthy relationship, folks. We're not saying just start running out and having sex. We're not talking about that. I got to be careful what we say. Okay.
So if somebody does come with sexual side effects, changing meds can help. Adding in things to take away the side effects of that can help too. Not that it's ever our goal to add more meds, right? That's just not the way we really want to work.
Okay.
Anytime people start new meds, I always keep an eye out for upset stomach, headache, nausea. That's pretty typical stuff that we might see when you start new meds. Sometimes the antidepressants might make you feel a little bit tired. But the big one, there's a big one with antidepressants, right? Up until the age of 24, there's like a black box warning on there that says that they can increase suicidal thoughts. Okay, and that's a big one.
So wait a minute. Now most people I know, if they're thinking about committing suicide, it's because they're depressed. So you telling me the drug that's supposed to make you feel like not doing that can cause you to think thoughts of doing that?
So this is why it's important you get meds through a professional, right? Through a
Okay.
provider, through somebody who knows. I mean, obviously, I've studied in this, so I'm saying you need to go see a psych NP or you need to go see a psychiatrist. That real world, best case scenario. If you're going to your pediatrician, if you're going to your family care doctor, they have received some of this base knowledge. Okay, but maybe not to the extent that like people who are specializing in psychiatry get. Okay, so there is. Go ahead.
No, I guess so. If I hear you correctly, now, if someone is going to take psychotropic medications, it would be best if they're prescribed and if they're seeing a psychiatrist, because you are the doctor, or you all are the doctors who are specialists in that field, so that you can check and make sure and do everything that needs to be done to make sure it's the right kind and the right dosage.
Correct.
I'm hearing you
wouldn't.
correctly? Yeah.
Correct. Yeah. I mean, you got heart problems that are severe heart problems. I mean, you go see a cardiologist, right?
Right.
And this is not different,
Right.
So, and let me explain that. So, like, again, they carry this up until the age of 24. You have this risk that they can increase suicidal thoughts. I always
Up to age 24.
Up to age 24. I always tell my patients, you're not going to wake up and feel like you want to die after taking this medicine the next day. It doesn't work like that. What
Okay.
we are seeing is if someone is not taking a good history, okay? So, family history, a good history of what is happening currently with their symptoms. Antidepressants carry the risk that they can be activating and you can have someone experience a bipolar episode. That's where the suicidal thoughts come in. It's activating,
Wow.
right? So I tell people what you're looking for is not that you're going to wake up and feel like you want to die. What you're looking for is more anxiety, more depression, more anger, more irritability, and then the suicidal thoughts come. So meds should make you feel better, not worse. If you take this and you feel
So,
worse, you must reach out to your provider, to emergency
okay.
services, to your parents. You don't keep that quiet. You have to let somebody know because that's not what we're
So,
trying to do.
so don't hesitate. If you're taking the medication that is supposed to help you up from the depression and you start feeling yourself, even if you hit a wave where maybe you're feeling good for a little while and then you find yourself going down and feeling a certain way, don't just keep taking the medication in hopes that things will level out. As soon as you start feeling this difference,
As soon
contact
as
your
you feel
provider.
different, yeah, if you feel like things are getting worse, and this usually happens in about like 1 to 2 weeks after taking the meds. So as soon as you
Okay.
feel this and you feel like things are getting worse, you need to let your provider know, right? Must
Okay.
let your provider know. Don't sit on it. Don't wait. You know,
Don't wait.
don't
Don't wait the 8 weeks that we talked about earlier today to
right.
get the medicines a chance
Well,
because this is happening. It's kicking in wrong.
your provider should be having you follow up in two weeks to a month, anyways, after starting new meds. So
Oh,
we
okay.
should be checking in and seeing what's going on. But all of that's really important. That's something like again, every patient that I have that conversation with because you need to know it. If meds make you feel weird, you need to let somebody know because it happens. It can happen. It could happen with an antibiotic. It could happen with a seizure medication. It could happen with your blood pressure meds. It could happen with cholesterol meds. If you take medicine and it makes you feel not right, don't wait. You need to let somebody know. That's not what's expected.
So make sure that you communicate with your doctor. Period. Appreciate that, Doc. So listen, Doc Melissa, you've given us a lot of information. And now, but I listen. If you don't mind, I got to keep you for a few more minutes
Yeah.
because I got to go to this round two. Now we were primarily talking about adults earlier and treating depression. Now we want to talk a little bit about ADHD in children and psych meds. Now, again, we know both of these topics, time won't permit us to really go in depth. We'll have Doc back again. But this time we want to talk about ADHD in children with psych meds. And I have another clip. This one is from Family Guy. Now, folks, if you have a problem with Family Guy, trust me, I understand. But living in the United States of America, freedom of speech, that's why they have survived for so long. But this particular clip I thought was excellent and again, it's a parody dealing with children and ADHD. And this one is titled Stewie Takes Adderall for His ADHD. But before we go there, Doc, would you briefly explain to us what well, you know what? No, we got a clip for ADHD, so we'll come back. Let for definition. Let's go ahead and go to the clip.
Oh, hi, Mrs. Griffin. I've actually been meaning to talk to you about Stewie. I'm concerned that he might have an attention problem.
Attention problem?
Yes, he's been a little difficult to deal with. And on page 2 of 3 in the How to Be a Teacher manual, it says that any child who's being difficult should be medicated.
What? Drugging a baby?
Are you sure? That sounds so serious.
I'm afraid his behavior has been an issue for a while. He's even been bothering students during nap time.
Hey, you up? Guess where I have a crayon? Sorry, I just prefer to do number 2 at home. Where were we?
It's Stewie, Dr. Hartman. He's having trouble focusing at school.
Ah, yes. So you're telling me your baby won't sit still in a way that's convenient for his teacher?
Yes.
I'd heard stories, but never thought I'd see it with my own eyes. Mrs. Griffin, I'm going to write Stewie a prescription for ADHD medication.
Really? Well, I don't know. Doesn't that stuff make you wired?
Well, if you're low energy and lethargic, yes. But if you're high energy, it actually calms you down and helps you focus. At least that's what I'm reading on WebMD. Wow, there are a lot of different kinds of medicines.
There's a cat in here.
Okay, I guess we can give it a try.
Here you go. Now, who's this little guy?
I hope somebody's asking more questions than that before they start you on meds. If they aren't, you should probably leave.
Oh, and listen, and we got a little more than that, but here we go. Okay, I love when it would say, oh, so he's being a typical kid. Now, Doc, listen, I can't show the clip I wanted to show. So let's get to the slide, Lewis, with the definition of ADHD. Okay, ADHD is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD, next slide, may have trouble paying attention, controlling impulsive behaviors, may act without thinking about what the result will be, or be overly active. Now, this definition is from the Center for Disease Control and Prevention. So, Doc, as one who has been in the trenches, why don't you give us your definition of ADHD? Or does this kind of suffice with what you have seen through the years?
So that definition is hard because name me a kid that doesn't fall in under that, right? Name me a child that doesn't fall in under that.
I was gonna say I'm a former classroom teacher, and I mean, heck, you check the boxes for every kid. I remember during I want to say it was probably the 90s going into the 2000s. What's the word I want to say? Prescribing ADHD medication was like they would hand us as teachers. Here's a checklist. Check, and then it would be
Vanderbilt.
Like,
could it be a Vanderbilt?
The kids on it, right? Probably the Vanderbilt. But yes, I mean it was like every child. If anyone even thought, do you think they're on ADHD? It's like, oh, we better give them some medicine. So yeah, I mean, I think there was a period of time where children were definitely being over medicated. I don't know about now today. I can't speak to it. But when I was in the classroom, I felt like children, like it was almost like, look, I don't want to say it's contagious, but it was like going through, and families would find out, oh, you put your kid on it? Okay, I'm going to put my kid on it too. So yeah.
It became like a culture.
Yeah,
listen.
Sure.
I can't tell you how many guys that I have met in the prison when I'm doing a mental status exam who tell me they were on Adderall, that they had ADHD, and I'm like, really? It's just like that. I mean, it's crazy how many people that they say had it, and like you said. But let me yield to you, Doc. Because you two have dealt, you two work with children all the time. So
it
I don't
is.
even know what to say. You all said it.
So I have.
But do some kids need it? I mean,
They do. They do.
What constitutes me needing it?
Yeah, great question.
I mean, I know I need it. I didn't find out I have ADD till I was like 43 years old, which explained a lot. It still does. But,
I had a psychiatrist say once that you are not supposed to make an ADHD diagnosis based off of someone's response on a stimulant, because you can give anybody a stimulant and the stimulant's going to help them to focus and concentrate and do better. Anyone. Okay. ADHD, it's whenever you can't, focus, concentrate, maybe we're hyperactive. There's different types of ADHD. But where the problem becomes an issue is whenever you're having these symptoms in more than one setting, okay? So say home and school, okay? We're having problems at home, can't get our homework done. We're having problems at school, we can't get our schoolwork done. And now our grades are dropping, right? Grades are dropping. Or Not say we're an adult, we're having problems at home, we have issues even going to the grocery store to remember to pick up the right stuff. We're having problems at work where we're kind of running behind or getting distracted or not meeting deadlines. That can all kind of be similar, right? So that's kind of it becomes a dysfunction, right? Where these symptoms become a dysfunction. I'm making the effort to try to do better. I'm writing my list and I'm still forgetting stuff. Like things like of that nature. Does that make a little bit more sense?
Oh, it makes a lot of sense. I mean, what's that song? You strumming my pain with your fingers. I'm.
It's
Does it get worse
honestly,
as you get older? Because I feel like I don't know if it's old age catching me or my ADD is catching me now.
it changes, right? What we see, we used to be, it used to be this train of thought that like as you got older, ADHD kind of went away, and it
Hmm.
doesn't. We're finding out we might be less hyperactive as adults, but those inattentive symptoms continue on. Okay,
Okay.
and I, I don't have the study in front of me. I think it was even as much as 70% of people that were diagnosed as kids continue to have problems as adults. And we did not think it was that great. We did not think it was
Wow.
that.
So now with
And
the
that's
hyperactivity
the
piece.
study coming through. Now, hyperactivity is a little bit different, right?
Mhm.
The portion of our brain where hyperness, impulsiveness, decision making sits here in our frontal lobe, and our frontal lobe continues to develop until we're about 25 years old. Okay, so as we get older, sometimes some of those symptoms do improve.
Okay. So for children, and like you and Lewis were talking about, we went through this phase as a society where we were just
It's
kicking
still
it
there.
out like crazy. So that combination, so kids were being kids, and they may have had an attention problem, but they were just being kids. So part of being a kid is being hyper. Part of being a kid is you have an interest in different things, and you may be distracted because your brain is still growing and developing. And so
Or
what may
because
be
school is
normal,
boring. School is,
huh?
Well,
or because
Or
school
because
is boring, which is often when kids have difficulty focusing. It's like, well, is the teacher to blame for that? I mean, it's one
oh, well,
thing.
so, there's been, and I feel like over the last several years, there's to me has been a real uptick in trying to provide medications to kids under the age of 6. And APA, so it's American Psychiatric Guidelines. They really recommend that you're not supposed to use meds first line under the age of 6 to treat ADHD. You're really supposed to do 3 months of therapy first. Okay, 3 months of therapy. See if we can't put some skills in place. Do some kind of play
right.
therapy, things like that to try and help before we even go down the route of meds. But what we're seeing is, we don't. It's not just daycare anymore, right? It's VPK. We've got kids in VPK that are like 3 and 4 and 5 years old, and we're expecting them to
On
sit there all.
medication? What?
Yes, sir. Yes, sir. Because we expect them to sit there all day. And we want them to sit in their seat because it's one teacher to 20 plus kids. And it's just, to me, I have a really hard time with it because are we expecting too much out of our kids that early? That is a lot. I personally think that's a lot. Um, and then,
You know,
you
what, Doc?
run.
I'll jump in real quick. They don't even do that in behavioral health hospital. That's called chemical restraint.
Mm.
So here's the thing, okay? Because I've worked in a couple different settings, and I've worked in a community mental health outpatient clinic. Okay, so you're talking rural community here in Florida, okay? That I worked, and we did not really take kids under the age of 6, not for psych. Therapy, yes. Psychiatry, no, because you really shouldn't be starting meds until they're older. Okay, until we hit 6 years old. Now we're talking kindergarten, first grade, and so on. Um, Always an exception to a rule. There's always going to be an exception, but it's the norm. We typically didn't take kids that young to medicate. I had the opportunity to work in a pediatrician's office for about a year and a half, where I was kind of like the psychiatric provider for a bunch of offices.
Okay.
It felt at times, and this is going to sound a little bit harsh, but it felt at times like they were handing out medication like candy. Where you're getting parents coming in, I can't control my kid, they need meds. Oh, okay, fill out this Vanderbilt scale. Vanderbilt scales is a list of questions that you're supposed to go run down and ask. Fill out this scale. Oh, you marked all of these threes, here's your meds. Psychiatry is more than just filling out paperwork. Psychiatry is asking questions, is delving into history. Psychiatry is just more than filling out paperwork. When you're in a pediatrician setting, maybe in that primary care setting, they're busy. Okay, they're quite frankly, I don't feel like they have time to sit down and listen to you talk about your problems. They are there to get you in, get you seen, and get you out the door and get the next person in. Mm-hmm. And so maybe they're not specialty providers. They're not a specialty provider trained to really ask the questions what need to be asked. So kids get put on meds. They get put on meds early.
So let me ask this question then with Doc, to you, Doc. So it sounds like it's almost like there are different brands of cars out there. You've got a Mercedes, you've got BMW, you've got Cadillacs. Now, you can take your car to a general, and I'm not putting anything down, but okay, if you've got a certain type of car, your car may need specific parts and specific service, and you want to have someone who specializes in working on your particular type of car. It sounds like you're saying when it comes down to psychiatry and when it comes down to treating ADHD, and when parents are they're depending on, and God bless our practitioners, we need them all. But it sounds like you're saying to me, you may want to stop and take your car to a Mercedes dealership to specifically have Mercedes check it out versus taking your car. I don't want to use the name of another spot but for a spot that's general, that works on all kind of cars, because that's not their specialty. So they might not get to the root of what's going on with your car.
Exactly. I've had kids where they come in and they've got the Vanderbilt filled out by the teacher, and the paperwork is indicating ADHD by the teacher, and you got the parents and it's got all zeros. Okay, so when you look at that, you can't even diagnose ADHD off of that, right? We're in two different settings. We're not having the same responses. What else is going on there? So for me, I sit there and I'm like, well, let's talk more, like what's going on. And quite frankly, there's been several cases where I think the kids are gifted. They're bored in school. So then it's the conversation and education of, hey, we need to go about it in this route. Or, hey, yeah, my kid is having a hard time. They are meeting some ADHD criteria, but hey, let's not jump to medication first. Let's exhaust resources through the school. Let's talk about a 504 plan. Let's talk about an IEP plan that gives special accommodations to kids. And I know about that because I'm a specialty provider. Not everybody knows about that. And that's not their fault, right? That's not their fault.
But that's just the reality.
It's just the reality. And don't anybody get me wrong. Our pediatricians, our family nurse practitioners, our pediatric nurse practitioners, our primary care doctors, you could not pay me enough to do their job. They have to know a little bit of everything. And that they have to know everything. And nobody can be expected to know everything all the time.
Well, and so it sounds like for those of us who are consumers, it's important for us to know that though the primary care doctor may be a professional and is a doctor, this is an area or a field that is not their specialty. And I don't have to feel as though I am slighting he or she by asking, can you refer me to a psychiatrist to deal with this? But if this is what you're thinking, this is what you think it is, or this is what the school thinks it is, okay, can you refer me to a psychiatrist so I can get that specialty?
Yes.
help.
Yep.
Let's go to the next slide because this makes it another reason why this is so important. We talked about there were 5 categories for the depression meds. Lewis,
You didn't even get them
look
all.
at this list.
Listen.
Yeah. This is just the common list of ADHD medications. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. 18, and this is not all of them. Doc, what are these things supposed to do? Well, you know what? Before we get to that, Lewis, let's go to the final clip of Stewie, because then we're gonna have Doc take us home and telling us what some of all these drugs are supposed to do for our children and helping them with being who they are. So this is the second part of Stewie. Stewie, now remember, we left Stewie. He was at the doctor's office. The doctor had prescribed the medication. And now let's see what happens to Stewie when he goes home.
Hey, where's Stewie?
Oh, he's probably sleeping off his pills.
What?
Well, the school said he had an attention problem, so Dr. Hartman gave him a prescription.
You're giving a 1-year-old drugs? You're doping up a baby. Peter, you okay with this? Will you stop talking? I'm trying to think about a girl I saw at the gas station. Stewie?
Welcome to Pillow World, Bri. Let me get up and greet you. There we go. How you doing?
Oh my God, Stewie, you're totally drugged out.
You know something? I've been thinking about how everyone in this family, Brian, does their job. And they do a pretty good job of it.
Still on those meds, huh?
Yeah, they help me to, think. Okay, time for an eyes open nap.
God, look what those pills are doing to you. Putting you on that stuff was a huge mistake. Like inviting a turtle to a cocktail party.
Hey, ask me why they call me a box turtle.
See, this is how American society treats unique, enthusiastic children. Instead of embracing their mental gifts, their first reaction is to shoot them up with hardcore drugs until they're mindless sheeple. All the better to send off to Kuwait and feed the Halliburton oil machine, right? Bush.
Yep, takes all kinds.
You know, a lot of kids in my school take ADD pills. They say if you're lazy and unmotivated, it makes you super energized and productive.
Really? Productive?
Yeah, and college kids take it all the time so they can focus on their studies and drink.
So, Doc, was that kind of on point with Stewie slowing down to, so what's the effectiveness, risk, and considerations when we're talking about ADHD medication in children? And one thing I got to say, I love something Brian said when he said, we want to penalize our children for their uniqueness. It's like trying to take control. When I was working in a behavioral health hospital, they said, you could talking about restraints, and chemical restraints. What you and Lou were saying that they want to do, especially in these daycares and stuff. To me, that's what it sounds like. It sounds like a way to keep control without finding another way to do it that's healthier and less controlling, for lack of a better word. It's effectiveness, risk, and considerations. What can you tell us? What do we need to know as parents and grandparents?
So stimulants are really effective. Okay, they're one of our most effective medications out there, right? We have found out that methylphenidate-based stimulants. So those are stimulants like Ritalin, Focalin, Concerta, Jornay. They help kids to focus and concentrate with less side effects. Okay, amphetamine-based stimulants. That's going to be like your Adderall, your Vyvanse. Kids tend to have a little bit more side effects on them, more decreased appetite. They can make them a little bit more angry, irritable. But overall, they work pretty well. I always kind of tell parents these meds are different. We talked about the antidepressants taking about 8 weeks to kick in. These don't work like this. These, if you take them, they work within 30 minutes to an hour, and they're out of your body by the afternoon.
Wait,
Afternoon,
wait,
evening,
wait a minute. Wait a
depending on
minute.
what time. They're kind of like ibuprofen. You take them, they
Wait.
work. You don't take them, they're not in your system.
So the child takes this. It works for a short, right away, but for a short period of time. So then they got to take it again.
So it depends. Stimulants, there's two different types of stimulants. We have short
Okay.
acting and long acting. And short
Okay.
acting stimulants you might have to take 2 or 3 times a day. Long acting, you usually take them once a day. So short acting maybe lasts
Mm.
3 to 5 hours. Long acting used to last about 8 to 10. We've got some newer meds out there. We got a brand new one called Astories that lasts about 13 hours. We've got another one that's been out for maybe going on 2 years. It's called Jornay. It's actually a 24-hour stimulant. They take it at night, kicks in the morning, is in their system all day long, and then is out about 6 p.m. There's lots of different options, right? Lots of different options to make that stimulant choice individualized to meet the needs of the kid.
Okay. So what are some of the things you would be looking at to make it unique and safe for a typical child? Because I know every child is different. You got to take in consideration age, weight, and environment, history, all these different things.
All of
But like just on the average,
it.
what would you?
I find less pills the better. Okay, it helps with compliance. I like the long acting stimulants. Concert is a good medication. Lasts about 8 to 10 hours. Get you through your school day. But if you can't swallow, you got to choose something else, right? It's a solid kind of capsule that you can't break open. Um, a lot, yeah. So there's other ones that are like Focalin is a good medication. Focalin is in a capsule that's got little beads inside of it. You can open it up if they can't swallow it. Like there's lots of little different options.
Mhm.
I appreciate the Jornay. Sometimes with stimulants, kids speak can get kind of like this reverse hyperactivity in the evening, reverse hyperness, reverse irritability, kind of as they're coming down off of medications. And Jornay just gives it a little bit smoother throughout the day, so they don't really experience that. Um, there's also like Vyvanse, that's an amphetamine, but it doesn't cross the blood-brain barrier. So if you've got concerns of substance use, you can snort that all you want. It's not going to make you high.
Yeah, and we're not telling anybody to snort that. Doc is just warning for some people who try to get their medications, from their friends, because toward the end, Stewie's sister was saying that her friends at school, which I've seen several shows, and that's like a big thing. Getting your hands on some Adderall to help you be able to concentrate and to focus while you're in school, and so that's a
Yeah,
little
and
scary.
actually, our research shows us that if there's substance abuse potential, kids that are actually using their stimulants, the substance abuse potential is lower, right?
Okay.
And yeah, and some of that's because this helps to slow your brain down enough so that you can think before you do something, right? It slows down that impulsivity, that quick response time, so you can hopefully make a better choice, make a better decision on things. Now, we don't want to be slowed down like Stewie is. Stewie's over medicated. That is not the end result. That is not what we're looking for. We expect a kid to be like themselves, but to be able to
Okay.
focus and concentrate and get their schoolwork done, not need that extra 15, 20 minutes to get through their schoolwork, that get through that test. After the test, the bell is rang. Not get stuck on that first question because now we get distracted. We can't even move to the next one, that kind of thing.
Okay. So there are pros and cons if it's done. There are pros, I should say. I stay there. There are pros if it's done right. It can help a child perform better in school. It can
Mm-hmm.
improve their social interactions in school and at home. But the flip side is, I think you said earlier, there could be some physical side effects. that you have
You
to
know,
watch out for? Are there, or are there, or was that with the depression medication only?
No, so there was for a really long time, and even still, I'll get asked about stimulants stunting kids' growth. Okay, stunting height, stunting weight, and you know what like more longitudinal studies. So these are studies done over longer lengths of time. What they actually show us is that kids that may take stimulants may be a little bit slower to grow, a little bit slower to gain weight, but they do eventually catch up. So it's not like you're going to take the stimulant and it's going to stunt your growth. It just might make things a little bit slower. Does that make sense?
Oh, yeah, it makes a lot of sense, and I'm so glad that you took time out your schedule to talk with us today, because we're going into the new school year, as Lou knows. You know, we're going into the new school year, in Alachua County, and I think Duval starts pretty soon as well. So, parents, we want you to understand that we want you to do your homework, and grandparents and guardians. We want you to do your homework. We want you to talk to your family practitioners. But then we're also strongly encouraging you to ask for referral to a psychiatrist if you are considering, or if you believe that your child needs medication for ADHD, or for any type of mood disorder for that matter. And my disclaimer for that, I am not a psychiatrist. I am not a doctor. I don't play one on TV. I'm a mental health counselor. And though Dr. Ennis Wainwright, though she does not have a private practice that she's trying to get you to go to. What she's simply trying to do, and what she's doing with us tonight, is just trying to help us all to be educated and to be aware of what's going on. So Doc, thank you so much for joining us today. I appreciate it. And listen, before you go, we have something that we started doing that we do at the end of each show, because sometimes through the course of the week, and I know especially for you and I, those of us who work in the prison system, and Lewis, I know even for you, man, working in the school system, it's something. Sometimes at the end, sometimes at the end of the day, don't bring you on this. No, you mean, Lewis, you mean you don't have those days where sometimes you just want to say, so this segment of the show, Lewis Doc always has a video or a clip that's, we just has to make us say, where's that from? What you got for us today, Lou?
All right. So basically, I don't know if Dr. Ennis is aware, but everyone's watching this Barbie movie right now, right? And that's all I'm hearing about. So I went and started looking on the web, and I found out that because of the Barbie movie and its success, they have created, of course, TikTok, our favorite, has created a challenge called the Barbie Foot Challenge. So we're going to learn real fast, what is the Barbie Foot Challenge? And doctors are actually saying it's probably not a good idea. Most of the TikTok challenges, you always have to ask yourself,
good ideas.
If it's on TikTok, it's probably not a good idea. But here we go. This is the Barbie Foot Challenge.
Greta Gerwig's Barbie has the world in a rose-colored glow. Google turns pink when you search for Barbie. Fans embrace all things Barbie, from wearing radiant pink outfits and calling it Barbiecore to posting the so-called Barbie Foot Challenge on TikTok. But health experts worry about the challenge, which is gaining millions of views on the social media platform, like they did about TikTok's viral handstand challenge. The Barbie Foot Challenge shows eager TikTok users copying Margot Robbie's now iconic scene where she slides off her fluffy pink heels and retains her trademark perfectly arched feet. Board-certified podiatrist at South Florida's Foot, Ankle, and Leg Pain Center, Dr. Jody R. Schoenhaus, says the challenge may make someone's legs look longer, but it's dangerous, especially if done often. She told the New York Post, if someone attempts the pose once or twice, they will likely be okay and produce a great TikTok video. However, if attempting the pose and stride over long periods, there are some risks involved. The ankle is unstable, which can lead to ligament sprains and injuries, commonly seen with high heel use. Getting the perfect video for your feed, then, might not be worth that third or fourth take, since walking on high arched feet like Barbie's is neither comfortable nor safe for us humans. Even Robbie, a former ballet dancer, confessed to needing 8 takes and a bar to hold onto when she performed the now viral scene. Plus, those heels were stuck to the floor with double-sided tape.
I just walked up, kind of held onto the bar above camera. What a perfect art.
Gerwig really didn't want to use CGI to achieve the shot, since Robbie's own feet were pretty perfect, and the Aussie actor really wanted to do the shot for real.
She has these beautiful dancer feet, and I was like, she'll just hang on to that bar and do it just like this.
Dallas Direct Podiatry's board-certified foot and ankle surgeon, Dr. Nam Tran, told Bustle that a Barbie doll's feet are simply put unrealistic. You only have to take a look at the different kinds of feet you see around you to know that. Even if someone were to have naturally arched feet, standing on your tiptoes and walking around all day long can cause problems. These include big toe pain and plantar fasciitis, according to the surgeon. Dr. Schoenhaus added another concern with the challenge. There's no support for the feet, unlike when you're holding that high arched posture while wearing heels. She told the New York Post, "Considering we aren't trained ballerinas on point, let's keep the fad to movie stars who have props and multiple takes to make it look perfect. Heels, too, are riskier than you think. Wearing heels might make you feel taller, more attractive, and confident, but it could be seriously hurting your feet. In fact, keeping your foot in a plantar flexed or downward extended position for long periods of time forces you to put stress on your forefoot. As a result, you're forced to unnaturally adjust the positioning of your lower and upper body to find balance. Heels also compromise the way we walk. While regular walking involves transferring weight from the heels through the arch to the balls of your feet, heeled feet don't allow you to push off the ground as you normally would. This causes strain on your knees and hip flexor muscles. Injuries, particularly ankle-related, are also a possible risk when wearing heels. Podiatrist Dr. Yolanda Ragland told Insider, "You could have just put on the shoe and headed out, literally take one step and step on a pebble, and then turn your foot inward, and then either strain or break the ligament structures around what we call the lateral side of the ankle, so the outer part of the ankle, and it's called a lateral ankle sprain." Ultimately, the health of our feet depends greatly on how we choose to stand and walk on them, so it might be a good idea to skip this challenge.
WTF. Really? So now, go ahead, Lou.
I was just saying, so
it's your baby.
Another movie creates another sensation, and we have to now go out there and tell all the kids with ADHD to stop walking on their toes.
Sometimes I worry about our generation.
Right, exactly.
Man.
Exactly.
But you know who's going to make money? But you know who's going to make money?
Yep.
Podiatrists. They are about to make a killing. You probably got podiatrists back there selling tickets to go see Barbie. Listen, you need to go see Barbie right now. Wow. I can't believe it. Thanks, Lou. And thank you, man. So listen, Doc, once again, Dr. Ennis, thank you so much for joining us today on Urban Therapist. We hope to have you back again. Doors always open to you. Even if you come up with a topic, you say, hey, listen, Ed, this is something came up. We need to get that out. You just let me know, and we'll make a spot and have you on the show. All right? And listen, everyone, we want to thank you again for joining us on The Urban Therapist. Remember, you can catch us on YouTube, Instagram, Facebook, Spotify, Apple Podcasts. Everywhere that you can hook up a computer, you can find us. Thanks for joining us again. And good shout out to my good friend and the co-host of The Urban Therapist, Mr. Lewis Rhodes. Appreciate you, man. And Doc, thank you again for joining us. Take care, everybody.